Cats don't commonly have seizures or fits, but they do happen from time to time, and this is another example of a serious an emergency situation, particularly if the seizure goes on for a long time, by which I mean more than a couple of minutes. A cat that has a full, complete seizure, a generalized seizure, will be unconscious and typically have paddling movements of the front and back legs, similar to a person having any sort of seizure. And important things to do in this scenario would include, firstly, to not stimulate your cat in any way, because any sort of stimulation, for example, stroking your cat or talking to your cat, actually tends to prolong the seizure. So if you can turn off anything that's making noise, like the radio, television, turn off the lights, be very calm and quiet, the seizure will tend to come to an end more quickly. If you're worried that the cat may hurt themselves, for example, they're on a chair and you're worried they're going to fall off, then you can gently lift them down and put them onto the floor. You don't need to worry about cats swallowing their tongues. You don't need to put your hands in their mouth or anything like that. Just stand back and observe them. And if you can, if you remember at the time to actually take any video footage of the seizure, that can be helpful, because not all seizures are generalized, and it can be useful as a vet to have detailed information about exactly what is happening to the cat while they're going through this fit. And also, if you can time how long the seizure lasts, then that can be helpful as well to us. If your cat's diabetic and receiving insulin therapy for their diabetes, then you will probably have been told that one possibility is that blood sugar levels can go too low as a consequence of insulin, particularly if the diabetes is temporary and the cat's condition is recovering. So if your cat is diabetic and it has any sort of a fit, it can be useful to have some glucose powder available, or failing that, even honey or jam in the house, and put some of this on the cat's gums if you can, without risking harm to yourself, where that sugar can be absorbed and help to correct that low blood sugar level. Still contact your vet, and still they will almost always are going to say bring your cat in so we can check blood glucose levels and make sure that they're stable thereafter. But all these little emergency tips can certainly help.